Now you have the community workers then, and they're talking to patients, but what is the role then of the provider? Is it talking to the community worker about who the patient is before they come in and what they might need? Or is it to make sure that they're, following the instructions of the community worker? What type of role would they play?
Yeah, that's a great question. I think it will depend on, particular offices and providers, how involved they want to be with the discussion with their patients. At the very least, I think, talking about nature as a brief part of the interaction with physicians and patients, just like talking about exercise, just like talking about smoking cessation, is important for sort of setting the baseline and expectation that this is something important. And then patients can spend more time with someone like a community health worker. So it's just recognizing the realities of physician time and limitations on time, and during any given well visit where there's many things that need to be covered.
Are there any specialties in particular where you might see more of a benefit than others?
So far, pediatrics has been leading the way on thinking about nature and health. And I would really like to see this also in the adult world. Certainly in primary care, I think is probably the most important place to start. Um, but there also is evidence of improved, for example, post-operative recovery after hip or knee replacements, for people that live in areas with a lot of nature. So I think there's room in other specialties like surgery, to implement programs like this as well.